Clove water benefits at night. Doctors never say these 15 health benefits of clove water. Clove water is a popular traditional remedy known for its potential health benefits. While it's essential to note that these benefits are not universally endorsed by medical professionals and scientific research is ongoing, some people believe that consuming clove water at night may offer various advantages. Here are 15 potential health benefits that some individuals associate with clove water consumption before bedtime. Better sleep is crucial for overall health and well-being. Poor sleep quality or insufficient sleep can lead to a range of physical and mental health issues. Here are some tips to help you achieve better sleep. Consistent sleep schedule. Try to go to bed and wake up at the same time every day, even on weekends. This helps regulate your body's internal clock. Create a bedtime routine. Establish a calming pre-sleep routine that signals to your body that it's time to wind down. This can include activities like reading, taking a warm bath, or practicing relaxation exercises. Comfortable sleep environment. Make sure your bedroom is conducive to sleep. This means a comfortable mattress and pillows, a cool and dark room, and minimal noise. Limit exposure to screens. The blue light emitted by phones, tablets, and computers can interfere with your sleep. Try to avoid screens for at least an hour before bedtime. Watch your diet. Avoid large meals, caffeine, and alcohol close to bedtime. These substances can disrupt your sleep patterns. Exercise regularly. Regular physical activity can improve sleep quality. However, try to finish your workout at least a few hours before bedtime, as exercising too close to bedtime can have the opposite effect. Manage stress. High stress levels can make it difficult to sleep. Practice stress reduction techniques like deep breathing, meditation, or yoga to relax your mind and body. Limit naps. While short naps can be refreshing, long daytime naps can interfere with nighttime sleep. If you need to nap, keep it brief, 20 to 30 minutes. Limit liquid intake. To avoid waking up in the middle of the night to use the bathroom, try to limit your liquid intake in the hours leading up to bedtime. Avoid clock watching. If you're having trouble falling asleep or waking up in the middle of the night, avoid constantly checking the clock, as this can create anxiety and make it harder to sleep. Seek professional help. If you consistently struggle with sleep and it's impacting your daily life, consider consulting a healthcare professional. They can help identify any underlying sleep disorders or issues and provide guidance on treatment. Natural remedies. Some people find that herbal teas like chamomile or a warm glass of milk before bed can promote relaxation and better sleep. Remember that individual sleep needs can vary, so it's essential to find a routine and strategies that work best for you. If you continue to have difficulties with sleep despite trying these tips, seeking advice from a healthcare provider or sleep specialist is advisable to rule out any underlying sleep disorders. Anti-inflammatory refers to the property of substances or treatments that can reduce inflammation in the body. Inflammation is a natural response by the immune system to injuries, infections, or irritants, and it typically involves redness, swelling, pain, and heat at the affected area. While acute inflammation is a necessary part of the body's defense mechanisms, chronic inflammation can be harmful and is associated with various health conditions, including arthritis, cardiovascular disease, and certain autoimmune diseases. Here are some ways to address inflammation, including both natural and medical approaches. Diet. Certain foods can either promote or reduce inflammation. A diet rich in fruits, vegetables, whole grains, and healthy fats, such as those found in fish, nuts, and olive oil, can help reduce inflammation. On the other hand, processed foods, sugary drinks, and foods high in saturated and trans fats can promote inflammation. Omega-3 fatty acids. Omega-3 fatty acids, found in fatty fish like salmon, mackerel, and sardines, flax seeds, and walnuts, have anti-inflammatory properties. Consider incorporating these into your diet. Turmeric and curcumin. Turmeric is a spice that contains curcumin, a compound known for its anti-inflammatory effects. It's often used in traditional medicine and can be added to dishes or taken as a supplement. Ginger. Ginger is another spice with anti-inflammatory properties. It can be consumed as a tea, added to dishes, or taken as a supplement. Exercise, regular physical activity can help reduce inflammation in the body. Aim for a balanced exercise routine that includes cardiovascular workouts, strength training, and flexibility exercises. Stress management, chronic stress, can lead to inflammation. Practicing stress reduction techniques like meditation, deep breathing, and yoga can help manage stress levels. Medications, in some cases, over-the-counter or prescription medications may be necessary to manage inflammation. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, are commonly used for this purpose. Prescription anti-inflammatory medications, for more severe inflammation, such as in autoimmune diseases or certain chronic conditions, healthcare providers may prescribe stronger anti-inflammatory medications like corticosteroids or disease-modifying anti-rheumatic drugs, MARDs. Lifestyle choices, avoiding smoking and limiting alcohol consumption can also help reduce inflammation and improve overall health. It's essential to consult with a healthcare professional before making significant changes to your diet or starting any new supplements or medications, especially if you have underlying health conditions or are taking other medications. They can provide personalized guidance based on your specific situation and needs. A digestive aid is any substance or remedy that helps improve the digestive process in the body. Proper digestion is essential for breaking down food, absorbing nutrients, and eliminating waste efficiently. Here are some natural and lifestyle-based digestive aids. Dietary fiber, a diet rich in fiber from fruits, vegetables, whole grains, and legumes can promote regular bowel movements and prevent constipation. Fiber also supports the growth of beneficial gut bacteria. Probiotics are live beneficial bacteria that can help balance the gut microbiome, aid in digestion, and reduce gastrointestinal issues. You can find probiotics in fermented foods like yogurt, kefir, sauerkraut, and kimchi, or take them as supplements. Digestive enzymes, these supplements contain enzymes like amylase, protease, and lipase, which help break down carbohydrates, proteins, and fats in the digestive tract. People with enzyme deficiencies may benefit from these supplements. Ginger has natural anti-inflammatory properties and can help alleviate nausea, indigestion, and upset stomach. You can consume ginger as a tea, in cooking, or as a supplement. Peppermint can relax the muscles of the gastrointestinal tract, which may relieve symptoms of irritable bowel syndrome, IBS, indigestion, and gas. Peppermint tea is a popular choice. Fennel seeds in tea can help alleviate indigestion, bloating, and gas. They may also have a soothing effect on the digestive tract. Chamomile tea can have a calming effect on the digestive system and may help reduce symptoms of indigestion and gas. Hydration, staying adequately hydrated is essential for maintaining healthy digestion. Water helps in the absorption of nutrients and the movement of food through the digestive tract. Mindful eating slowly and mindfully, without rushing, can aid digestion by allowing your body to properly chew and break down food. Regular exercise, physical activity can help keep the digestive system functioning smoothly by promoting regular bowel movements and reducing the risk of constipation. Avoid overeating, eating large meals can put stress on the digestive system. Aim for smaller, more frequent meals to ease the digestive process. Limit trigger foods. Some people may be sensitive to certain foods like spicy foods, dairy, or gluten. Identifying and avoiding trigger foods can help prevent digestive discomfort. Reduce stress. Chronic stress can negatively impact digestion. Engage in stress reduction techniques like meditation, yoga, or deep breathing exercises. If you experience persistent digestive issues or have concerns about your digestion, it's advisable to consult with a healthcare professional, such as a gastroenterologist or a registered dietitian. They can help identify the underlying causes of your digestive problems and provide personalized guidance on dietary changes or other treatments if necessary. Oral health refers to the condition of your mouth, including your teeth, gums, and overall oral hygiene. Maintaining good oral health is important not only for your mouth, but also for your overall well-being. Here are some key aspects and tips related to oral health. Regular dental checkups. Schedule regular dental appointments with a dentist or dental hygienist. These checkups are essential for early detection and prevention of oral health issues. Brushing. Brush your teeth at least twice a day, ideally in the morning and before bedtime, using fluoride toothpaste. Brushing helps remove plaque, a sticky film of bacteria that can lead to tooth decay and gum disease. Proper brushing technique. Use a soft bristle toothbrush and gentle, circular motions to clean all tooth surfaces. Pay attention to the front, back, and chewing surfaces of your teeth, as well as your tongue and the roof of your mouth. Flossing. Flossing once a day helps remove food particles and plaque from between your teeth and along the gum line. Proper flossing is essential for preventing cavities and gum disease. Mouthwash. Consider using an antimicrobial or fluoride mouthwash as part of your oral hygiene routine. Mouthwash can help reduce bacteria, freshen breath, and strengthen tooth enamel. Balanced diet. A diet rich in fruits, vegetables, whole grains, lean proteins, and dairy products provides essential nutrients for healthy teeth and gums. Avoid excessive consumption of sugary and acidic foods and drinks, as they can contribute to tooth decay. Hydration. Drink plenty of water to maintain proper saliva production. Saliva helps neutralize acids, clean the mouth, and protect tooth enamel. Limit sugary snacks. If you consume sugary snacks or drinks, try to do so in moderation. Snacking on sugary foods throughout the day can increase the risk of tooth decay. Protect your teeth. If you engage in contact sports or grind your teeth at night, consider using a mouthguard or a night guard to protect your teeth from injury and wear. Quit smoking and tobacco use. Smoking and tobacco use increase the risk of gum disease, tooth loss, and oral cancer. Quitting is one of the best things you can do for your oral and overall health. Address dental issues promptly. If you experience dental pain, bleeding gums, or any oral health problems, seek professional dental care promptly. Early treatment can prevent issues from worsening. Teach good oral habits. Educate children and family members about the importance of good oral hygiene from an early age. Encourage healthy habits like regular brushing and flossing. Professional cleanings. Regular professional cleanings by a dental hygienist help remove plaque and tartar buildup that cannot be effectively removed through brushing and flossing alone. Remember that oral health is closely linked to overall health. Poor oral health can contribute to systemic health issues such as cardiovascular disease and diabetes. Therefore, maintaining good oral hygiene practices is essential for a healthy and happy life. Pain relief involves the alleviation or reduction of physical discomfort or pain. Pain can arise from various sources, including injuries, medical conditions, inflammation, and chronic conditions. The approach to pain relief depends on the type and severity of pain, and it can range from simple home remedies to medical interventions. Here are some strategies and methods for pain relief. Over-the-counter, OTC, pain medications. Non-prescription pain relievers like acetaminophen, Tylenol, ibuprofen, Advil, Motrin, and naproxen, Aleve, can be effective for mild to moderate pain. Follow the dosing instructions carefully. Prescription pain medications. For more severe pain, your healthcare provider may prescribe stronger pain medications, such as opioids. It's crucial to use these medications under medical supervision, as they can be habit-forming and have side effects. Topical analgesics, creams, gels, or patches containing ingredients like menthol, lidocaine, or capsaicin can provide localized pain relief when applied directly to the affected area. Physical therapy. Physical therapy can help with pain management by improving strength, flexibility, and mobility, especially for conditions like musculoskeletal injuries or chronic pain. Heat and cold therapy. Applying heat or cold to the painful area can alleviate discomfort. Heat can relax muscles and improve blood flow, while cold can reduce inflammation and numb the area. Massage. Therapeutic massage can help relax muscles and reduce tension, providing relief from muscular pain and stress. Acupuncture. Acupuncture involves the insertion of thin needles into specific points on the body to alleviate pain and promote healing. Some people find it helpful for various types of pain. Chiropractic care. Chiropractors specialize in the treatment of musculoskeletal conditions and can help with pain relief through spinal adjustments and other techniques. Mind-body techniques, practices like meditation, deep breathing, and mindfulness can help reduce pain by promoting relaxation and reducing stress, which can exacerbate pain. Hydration and nutrition, staying well hydrated and maintaining a balanced diet with anti-inflammatory foods can support overall health and potentially reduce pain associated with inflammation. Rest and sleep, adequate rest and quality sleep are essential for the body's natural healing processes and can help reduce pain perception. Counseling and psychological support, chronic pain can have a significant psychological component. Therapy and counseling can help individuals cope with the emotional aspects of pain and develop strategies for managing it. Alternative therapies, some people explore alternative therapies like herbal remedies, essential oils, or homeopathic treatments for pain relief. It's essential to consult with a healthcare provider before using alternative treatments, especially if you have underlying medical conditions. Prescribed therapies, depending on the underlying cause of the pain, your healthcare provider may recommend specific treatments or interventions, such as surgery, corticosteroid injections, or physical rehabilitation. It's crucial to consult with a healthcare provider to determine the most appropriate pain relief strategies for your specific condition. Additionally, always follow their guidance and recommendations for safe and effective pain management, especially if you have chronic or severe pain. Stress reduction involves adopting strategies and practices to manage and alleviate the physical and psychological effects of stress. Chronic stress can have adverse effects on both mental and physical health, so it's essential to find effective ways to reduce and cope with stress. Here are some stress reduction techniques and practices. Deep breathing, deep, slow, and controlled breathing can activate the body's relaxation response, reducing stress and anxiety. Try techniques like diaphragmatic breathing or the 4-7-8 technique. Mindfulness meditation. Mindfulness meditation involves focusing on the present moment without judgment. Regular practice can help reduce stress and improve overall well-being. Yoga. Yoga combines physical postures, breath control, and meditation to promote relaxation, flexibility, and stress reduction. Progressive muscle relaxation. This technique involves systematically tensing and relaxing muscle groups in the body to reduce physical tension and stress. Guided imagery. Guided imagery involves using your imagination to create calming and positive mental images, reducing stress and promoting relaxation. Journaling. Keeping a journal can help you express your thoughts and emotions, gain insight into your stressors, and identify solutions. Physical activity. Regular exercise releases endorphins, which are natural stress relievers. Activities like walking, jogging, swimming, or dancing can be effective in reducing stress. Social support. Talking to friends, family members, or a therapist can provide emotional support and help you navigate stressful situations. Time management. Effective time management and organization can reduce the feeling of being overwhelmed, leading to less stress. Healthy diet. A balanced diet can support your physical and mental health. Avoid excessive caffeine, sugar, and alcohol, which can contribute to stress. Adequate sleep. Getting enough restorative sleep is crucial for stress management. Establish a regular sleep routine and create a comfortable sleep environment. Limiting stimulants. Reduce or eliminate the consumption of stimulants like caffeine and nicotine, as they can increase stress levels. Setting boundaries. Learn to say no when necessary and establish healthy boundaries to prevent overcommitment and stress. Hobbies and leisure activities. Engaging in activities you enjoy can provide a break from stressors and promote relaxation. Professional help. If stress becomes overwhelming and interferes with daily life, consider seeking help from a therapist or counselor who specializes in stress management. Biofeedback. Biofeedback techniques can help individuals learn to control physiological responses to stress, such as heart rate and muscle tension. Laugh and have fun. Laughter can trigger the release of endorphins and reduce stress hormones. Enjoying humor and spending time with loved ones can be beneficial. Mindful eating. Pay attention to what you eat and savor your meals. Eating mindfully can help reduce stress-related overeating. It's important to note that different stress reduction techniques work for different individuals, so it may take some trial and error to find what works best for you. A combination of strategies is often the most effective way to manage stress. If you find that stress is severely impacting your daily life, consider seeking guidance from a mental health professional who can provide personalized strategies and support. Antimicrobial refers to substances or treatments that have the ability to kill or inhibit the growth of microorganisms, including bacteria, viruses, fungi, and parasites. These substances are used to prevent or treat infections caused by various pathogens. Antimicrobial agents can take many forms, including antibiotics, antiviral medications, antifungal drugs, and disinfectants. Here are some key points about antimicrobial agents. Antibiotics. Antibiotics are a type of antimicrobial agent specifically designed to combat bacterial infections. They work by targeting and killing bacteria or inhibiting their growth. Common antibiotics include penicillin, amoxicillin, and erythromycin. Antiviral medications. Antiviral drugs are used to treat viral infections by inhibiting the replication of viruses within the body. They are commonly prescribed for conditions such as influenza, HIV, and herpes. Antifungal drugs. Antifungal medications are used to treat fungal infections, which can affect the skin, nails, or internal organs. Examples include fluconazole and terbinafine. Antiparasitic drugs. Antiparasitic agents are used to treat infections caused by parasites, such as malaria, giardiasis, and head lice. These drugs can vary widely depending on the type of parasite being targeted. Disinfectants and antiseptics. Disinfectants are used to kill or inhibit the growth of microorganisms on surfaces or in the environment, while antiseptics are used on living tissues, such as skin and mucous membranes. Common examples include alcohol-based hand sanitizers and hydrogen peroxide. Resistance. The overuse and misuse of antimicrobial agents have led to the development of antimicrobial resistance, AMR. This occurs when microorganisms evolve to become resistant to the drugs that were once effective against them. AMR is a global health concern, as it can make infections more difficult to treat. Prescription and proper use. Many antimicrobial agents are prescription medications, and it's essential to use them exactly as directed by a healthcare provider. Not completing a prescribed course of antibiotics, for example, can contribute to the development of antimicrobial resistance. Hand hygiene. One of the most effective ways to prevent the spread of infections is through good hand hygiene. Regular hand washing with soap and water or the use of hand sanitizers can reduce the transmission of harmful microorganisms. Vaccination. Vaccines are a critical tool in preventing infectious diseases. They work by stimulating the immune system to develop immunity against specific pathogens, reducing the need for antimicrobial treatments. Infection control measures. In healthcare settings, infection control measures, such as proper sterilization of medical equipment and adherence to hygiene protocols, are crucial to prevent the spread of infections. It's important to note that the use of antimicrobial agents should be guided by healthcare professionals, as improper use or overuse can have negative consequences, including the development of resistant microorganisms. Public health efforts are also focused on promoting responsible antimicrobial use to combat the growing problem of antimicrobial resistance. Respiratory health refers to the overall well-being and proper functioning of the respiratory system, which includes the organs and structures involved in breathing. This system is responsible for taking in oxygen from the air and expelling carbon dioxide, a waste product of metabolism. Maintaining good respiratory health is essential for overall well-being and quality of life. Here are some key aspects of respiratory health. Healthy lungs. Healthy lungs are crucial for optimal respiratory health. They should be free from infections, inflammation, and structural issues. Common respiratory conditions affecting the lungs include asthma, chronic obstructive pulmonary disease, COPD, and pneumonia. Efficient breathing. Efficient and unobstructed airflow is essential for respiratory health. Conditions such as bronchitis or the presence of foreign objects can hinder airflow. Oxygen exchange. The primary function of the respiratory system is to facilitate the exchange of oxygen and carbon dioxide in the blood. This process occurs in tiny air sacs called alveoli within the lungs. Preventing infections. Good respiratory health involves minimizing the risk of respiratory infections like the common cold, flu, and respiratory syncytial virus, RSV. Proper hygiene, vaccination, and avoiding close contact with infected individuals can help prevent infections. Asthma management. Asthma is a chronic respiratory condition characterized by airway inflammation and bronchoconstriction. Proper management with medications and avoidance of triggers is essential for maintaining respiratory health. COPD management. COPD is a progressive lung disease that includes chronic bronchitis and emphysema. Smoking cessation, medications, and pulmonary rehabilitation are part of COPD management. Environmental factors. Exposure to environmental pollutants like tobacco smoke, air pollution, and allergens can harm respiratory health. Minimizing exposure to these factors is important. Proper nutrition. A balanced diet rich in antioxidants, vitamins, and minerals can support lung health. Certain nutrients, like vitamin C and magnesium, are particularly beneficial. Regular exercise. Physical activity promotes lung function and overall respiratory health. It can also improve cardiovascular health, which is closely related to the respiratory system. Hydration. Staying well hydrated helps maintain the thin mucus lining in the respiratory tract, which is important for trapping and removing pathogens and irritants. Breathing techniques. Techniques like deep breathing exercises and pursed lip breathing can help individuals with respiratory conditions improve their lung function and manage symptoms. Allergy management. Allergies to airborne substances can exacerbate respiratory issues. Identifying and managing allergies through avoidance or treatment can improve respiratory health. Vaccination. Certain vaccines, like the influenza, flu vaccine, and the pneumonia vaccine, can protect against respiratory infections and complications. Medication management. If prescribed medications for respiratory conditions, it's important to take them as directed by a healthcare provider. Early detection. Regular checkups with a healthcare provider can help detect respiratory issues early, allowing for timely intervention and management. Respiratory health is essential for overall well-being and quality of life. If you have concerns about your respiratory health or are experiencing symptoms such as coughing, shortness of breath, or chest pain, it's important to seek medical advice and evaluation from a healthcare professional. They can provide guidance and treatment tailored to your specific needs. Blood sugar regulation is the process by which the body maintains a stable level of glucose, sugar, in the bloodstream. This regulation is essential because glucose is the primary source of energy for cells, and maintaining stable blood sugar levels is crucial for overall health. The hormone insulin, produced by the pancreas, plays a central role in regulating blood sugar. Here are key aspects of blood sugar regulation. Glucose homeostasis. The body strives to keep blood glucose levels within a narrow range to ensure that cells have a steady supply of energy. Normal fasting blood sugar levels typically fall between 70 and 100 mg per deciliter, mg/dl, or 3.9 to 5.6 millimoles per liter, mol/L. Role of insulin. After eating, especially when carbohydrates are consumed, blood sugar levels rise. In response, the pancreas releases insulin into the bloodstream. Insulin facilitates the uptake of glucose into cells, where it can be used for energy or stored as glycogen, a form of stored glucose. Glucagon. When blood sugar levels drop, typically between meals or during fasting, the pancreas releases glucagon. Glucagon signals the liver to convert stored glycogen back into glucose and release it into the bloodstream, raising blood sugar levels. Other hormones. In addition to insulin and glucagon, other hormones such as cortisol and epinephrine can affect blood sugar levels, particularly in response to stress or low blood sugar, hypoglycemia. Dietary factors. The types and amounts of carbohydrates, fats, and proteins consumed in a meal can impact blood sugar levels. Carbohydrates, especially simple sugars and refined carbohydrates, can cause rapid spikes in blood sugar, while fiber-rich complex carbohydrates have a slower and more gradual effect. Physical activity. Regular physical activity can help regulate blood sugar by increasing the sensitivity of cells to insulin, allowing for better glucose uptake and utilization. Medications. For individuals with diabetes, medications such as insulin, oral antidiabetic drugs, or other injectable medications may be prescribed to help control blood sugar levels. Monitoring: people with diabetes or those at risk of blood sugar imbalances may monitor their blood sugar levels regularly using glucometers. This helps them make necessary dietary and medication adjustments. Weight management: maintaining a healthy weight through a balanced diet and regular exercise is crucial for blood sugar regulation. Excess body fat, especially around the abdomen, can increase the risk of insulin resistance and type 2 diabetes. Meal timing: eating regular, balanced meals and snacks throughout the day can help stabilize blood sugar levels and prevent spikes and crashes. Stress management: chronic stress can impact blood sugar levels. Stress management techniques, such as relaxation exercises and mindfulness, can be helpful. Medical care: individuals with diabetes should work closely with healthcare providers to develop a personalized diabetes management plan, which may include medications, dietary guidance, and monitoring. Proper blood sugar regulation is essential for preventing and managing conditions like diabetes. People with diabetes, in particular, need to be vigilant about monitoring and managing their blood sugar levels to prevent complications. A balanced diet, regular exercise, and a healthy lifestyle are fundamental in supporting blood sugar regulation and overall health. If you have concerns about your blood sugar levels or diabetes risk, consult with a healthcare provider for guidance and testing. Weight management. Weight management refers to the process of achieving and maintaining a healthy body weight through a combination of proper diet, regular physical activity, and lifestyle choices. Maintaining a healthy weight is essential for overall health and can help reduce the risk of various chronic diseases, including heart disease, diabetes, and certain types of cancer. Here are key principles and strategies for effective weight management. Balanced diet: adopt a balanced and nutrient-dense diet that includes a variety of foods from all food groups. Focus on whole, unprocessed foods such as fruits, vegetables, whole grains, lean proteins, and healthy fats. Caloric balance: weight management is fundamentally about balancing calories consumed with calories expended. To lose weight, you must create a calorie deficit, consume fewer calories than you burn, and to maintain weight, calories in and out should be roughly equal. Portion control: be mindful of portion sizes to avoid overeating. Use smaller plates, measure servings, and pay attention to hunger and fullness cues. Regular meals and snacks: eating regular, balanced meals and snacks throughout the day can help prevent excessive hunger and overeating. Hydration: drink plenty of water throughout the day. Sometimes thirst can be mistaken for hunger. Limit sugary and processed foods: reduce consumption of sugary beverages, sweets, and highly processed foods, which can contribute to weight gain and health issues. Mindful eating: pay attention to what you eat, savor each bite, and eat without distractions. This can help prevent overeating and promote healthier food choices. Physical activity: engage in regular physical activity. Both cardiovascular exercises, example walking, running, cycling, and strength training, can contribute to weight management by increasing calorie expenditure and improving metabolism. Aerobic exercise: aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week, as recommended by health guidelines. Strength training: include strength training exercises at least 2 days a week to build muscle, which can help boost metabolism and support weight management. Consistency is key in weight management. Maintain a regular exercise routine and stick to healthy eating habits. Sleep: prioritize quality sleep, as inadequate sleep can disrupt hormones that regulate appetite and contribute to weight gain. Stress management: high stress levels can lead to emotional eating and weight gain. Practice stress reduction techniques such as meditation, deep breathing, or yoga. Support and accountability: consider seeking support from a registered dietitian, a personal trainer, or a weight management program. Sharing your goals with friends or family members can also provide accountability. Set realistic goals: establish achievable and realistic weight loss or maintenance goals. Gradual, sustainable changes are more effective and maintainable than extreme or crash diets. Monitor progress, keep track of your food intake, physical activity, and progress toward your goals. This can help you identify areas for improvement. Seek professional help. If you're struggling with weight management, consider consulting with a healthcare provider or a registered dietitian who can provide personalized guidance and support. Remember that healthy weight management is a long-term commitment and should prioritize overall health and well-being rather than extreme weight loss methods. It's important to focus on building sustainable habits that you can maintain for life.